Hello, this is Dr. Sukalyan Purkayastha, and I'm a neurointerventionist, and today I'll be talking about the endovascular treatment of brain aneurysms, and I'll be mainly briefing about what is a brain aneurysm, how important the disease is, and how we treat brain aneurysm with the endovascular approach. Okay, so if the brain aneurysm is a tiny outpouching of in a part of the brain artery, but the disease is the disease is very important because they don't give you much time to think about it, and when it ruptures and when it leaks, when the balloon leaks, he or she gets the worst headache of life. So, and depending of the amount of blood which comes out from the artery, the patient can be unconscious or the patient may even die. So the bleed, what this brain aneurysm causes, we call it subarachnoid bleed. That is a bleed which is layering the brain surface in a space, potential space called subarachnoid space, where the brain, most of the basal brain arteries are located. So half of these patients, when untreated, the patients who are having this aneurysm, they die of or they are left with severe neurological deficit. Okay, and 50% of those patients, they bleed within 6 months again if left untreated. So you can understand that how severe the disease is. Now, what is an aneurysm? As I've told you, this is a sac which arises from the artery. That means it's a blister-like outpouching or a balloon-like outpouching, and it has got a wall, very thin wall, and the area where it is attached to the main artery, we call it neck. Now let's come to the treatment part. So the endovascular way of treating means that we puncture the groin artery, and under fluoroscopic control we take the instruments like catheters, we reach the aneurysm sac from the groin artery, and we try to we fill the aneurysm sac with platinum coils. We call it endovascular coiling. Right, so this is one way of treating it endovascularly, and this is an example I'm showing you. So this aneurysm is situated in the region we call it basilar top, right, and you can see the coil mass which is filling the aneurysm, and after coiling you can see the aneurysm is not seen anymore. So this is an elegant treatment where by simply putting the platinum coils we can treat those aneurysms. Now sometimes the aneurysms are a bit complex in shape, where the neck is a bit more. The neck is the area, as I've told you, where it is attached to the main artery. So you have to support the neck. How do we support that? We support by putting a balloon or by putting a stent across the neck. And after doing that, we can simply fill the aneurysm sac, that is the volume of the aneurysm, again with platinum coil, and we call that balloon assisted coiling or stent assisted coiling. Now here is an example where you can see a big aneurysm which is arising from the internal carotid artery, and we have placed a balloon here in the artery to support the coils, and we are filling the sac with coils, and after coiling you can see that the aneurysm is not seen anymore. This is another example where this is quite an ugly looking aneurysm. You can see from this anterior communicating artery, and we have placed again a balloon across the anterior communicating artery, and then with balloon assistance we are filling the sac of the aneurysm with platinum coils. So this is the way when we treat those aneurysms, we call it balloon assisted coiling of the aneurysm. Sometimes the neck is too complex so that simply balloon may not help. In that particular situation, we may take the help of a stent All of you know what is a stent. Stent, the cardiologists are using it through ages, but the stents what we use inside the brain are specialized stents. They are not those sort of stents were used in cardiology, and they are very soft stents. You can mold it in different angles, and they can take bends, and they support the aneurysm neck. And when we fill the sac with the coils, the stents keep the coils in place, and that's how it prevents further regrowth of the aneurysm or any potential, or it stops the risk of any further risk of bleed from the aneurysm. So here's an example. It's a broad neck basilar bifurcation with a ugly looking daughter sac from the dome of the aneurysm, and how you can see that how elegantly we have treated with stent assisted coiling. Now, one last example I want to show you. This is what we call a 3D rotational angiogram. So we treat the aneurysms in our catheterization laboratory in either a single plane or biplane, but the availability of a 3D rotational angiogram is a must, because here you can see that the aneurysm in the anterior communicating artery, a broad neck, ugly looking aneurysms, and if you do not have a 3D angiogram, you cannot get a proper knowledge of this aneurysm, and you cannot plan it properly. So you can see that we have placed a stent across the anterior communicating artery. You can see the ends of the stent. Sometimes the whole of the stent is not visible by fluoroscopy, only the markers at the end of the stents are visible, and the coil mass, the platinum coil mass, is visible because they are radio opaque, and you can see that how the aneurysm is completely gone, and that is only possible because we have used the stent here. And this is again 3 months control angiogram. You can see that the aneurysm is completely gone and it's stable. Now, this is, in short, I've discussed the various endovascular means how we treat. In another talk, I'll be talking about a specialized device called flow diverter. But in this talk, I have talked about the simple coiling, the coiling with balloon assistance, and the coiling with stent assistance. So if any of you face any such problem, you should ask your doctor that whether this sort of treatment is available in their hospital, because this is one of the best treatment worldwide at this point of time when we talk about the treatment of the brain aneurysms. And I should also mention here that the alternative to endovascular treatment is the open surgical clipping, where we cut open the skull and go inside and put a clip across the neck of the aneurysm, and that's how you prevent blood entering inside the aneurysm sac and prevent further bleeding. By endovascularly, we do not open the skull, so it is much safer technique and equally effective technique. So worldwide, I would say around more than 95% of the aneurysms are now being treated with an endovascular means, and newer devices have come, and which has made our procedures very and extremely safe. And when the patient comes out of these procedures, they don't even understand that such a complex treatment has been done and without leaving a scar on their body. So this is, I would say, that this knowledge should go more and more to the general population, so that they should know about this sort of treatment which is nowadays available. And I am working here in this Institute of Neuroscience for last more than 10 years, and we are treating these aneurysms both by endovascular means or by open surgical means in our hospital. And I think endovascular means of treating the aneurysm is one of the best type of treatment of this disease at this point of time. Thank you.